Hi, my name is David Bradford, and I'm a rising sophomore from Chicago, Illinois, majoring in cognitive neuroscience. My essay, COVID-19 Meets Systemic Racism, is about some of the disparities that Black and Latinx communities are currently facing in the coronavirus pandemic. As the time came for freshmen in college writing to pick their final research topics, I was hearing more and more about how COVID was disproportionately affecting minorities, especially in the Black community. In Chicago, African Americans made up more than 70% of the city's total COVID deaths by early April. For my research project, I wanted to find the specific factors that could be responsible for these disparities. I first looked for patterns of racial disparities in previous pandemics and found research from the H1N1 pandemic detailing disparities in exposure, susceptibility, and access to healthcare affecting racial and ethnic minorities. Though we don't know the full picture of COVID's behavior yet, I felt that it spread similarly enough to influenza where we would be able to find evidence of some of these racial disparities in today's COVID-19 pandemic. I created a survey to scope the impact of these disparities on my local minority communities. Though not as defined as a population of large infected individuals, I found the Black and Latino survey respondents were significantly more likely than white respondents to live in an apartment, take public transportation, be furloughed, and face discrimination when seeking health care, all factors linked to disparities in exposure and access to proper testing and treatment. Minority respondents were also more likely to believe that their families' living conditions might put them at a higher risk of contracting COVID-19 and that their family's access to healthcare might negatively impact access to proper testing and treatment. What surprised me the most about this research is the sheer number of factors that make minorities more susceptible to infection or death. Though health disparities have always been a problem, the very high number of COVID-19 infections in this country are bringing attention to the fact that these patterns are a systemic issue. Living and working conditions have the biggest influence on someone's possible exposure to COVID-19, conditions that are directly linked to race and socioeconomic status, putting Black and Latinx communities at a major disadvantage. For a large portion of this country's history, the housing and employment systems deliberately shut out minorities. This has created a considerate wealth gap that blames high rates of poverty in Black and Brown communities on personal attributes rather than systemic inequities. Additionally, pre-existing conditions and healthcare discrimination further affect minorities' likelihood of surviving COVID-19 if exposed to it. As someone who would like to work in the medical field in the future, this project was especially important to me because it emphasizes the need to actively address medical racism. Medicine was built on the exploitation of Black and Brown bodies, and the remnants of this mistreatment are still seen today. Medical students and physicians still largely believe that Black people feel less pain, and Black mothers are 2 to 3 times more likely than white mothers to die during childbirth. As pre-medical students, I think we have the responsibility to educate ourselves of these misconceptions and disparities and actively work to address them. The Black Lives Matter protests in honor of George Floyd have brought international attention to the racially biased treatment of Black men and women in this country. These protests have attempted to expose the role that systemic racism plays in the constant oppression of Black people. Racism is present everywhere, in the criminal justice system, education, housing, healthcare systems, and beyond. The health disparities that we're currently experiencing are just one of the many reflections of how this country is designed to deliberately work against Black people and minorities. Though Black Lives Matter protests have been going on for more than a month now, protesters have been adamant about following CDC protocols and wearing face masks at all times, helping to prevent possible outbreaks. The irony between protesting against police brutality during a pandemic that disproportionately affects the same group of people further emphasizes the need to address the common cause behind these seemingly unconnected happenings. If there was one thing I would want people to be able to take from my research, is that racism won't always be explicit. A lot of the times, racism is present in microaggressions and biases towards minorities, and it's also present in the everyday systems that we have to interact with, because this country was designed to benefit at the cost of Black and Brown lives. And we should all take an active role in advocating for racial equity in this country.